our skin. It has a global growth percent of 7.4%, and it'll hit 15.5% because of the awareness that's happening and the disposable income that's available easily. But breast implant, which is surgical, still stays at 6.1%. So if you look at this is the evolution right here. But what is more important right here is if you look at the popularity in Asia. In Asia, China is undoubtedly the leader in cosmetic trends. Then it's Japan and South Korea, and number 4 is India, and then it's Taiwan for any of these procedures. But if you look at the non-surgicals though, in terms of laser, you'll see that India is at number 3 after China and Japan. But China is the one that's booming right now. It's not yet India. So in summary, I'm going to leave you with a thought for this video. Yes, to Satya's question, which he posed to me, is India going to follow these trends? India will follow the trends, but it's still going to take time because we're still developing. And as I told you, the wellness continuum has to take place. But this is a summary as to why it is going to boom. I think that'll summarize why this industry will grow. Thank you.
Thank you so much, Dr. Chaitra. Actually, she has put forward a very strong case through her statistics that proves that beautiful people do have advantages in all walks of life. And of course, she has termed it very beautifully that yes, it's a new stream of medicine, which is an aspirational medicine. And of course, India also has got good prospects in this form of this sector of healthcare. Thank you so much, Dr. Chaitra. I would now request Mr. Satya to please come forward to offer a token of appreciation to Dr. Chaitra. We go to the next session now, from beauty to some serious business, which is cancer. And the title of the next session is India's Rising Prowess as Top and Global Healthcare Destinations in Cancer Care, Challenges and Opportunities. I would now call upon Dr. Sandeep Chatrath, CEO, Dharamshila Hospital and Research Center. Dr. Sandeep Chatrath.
Friends, it was a very great learning experience this morning, listening to such great speakers. I would especially like to thank Mr. Satyabhama for giving us the opportunity here to talk about cancer care. And the theme, Make in India, I put it that Make in India, Make for World. People all over the world are coming to India for availing the cancer care treatment and especially for medical tourism, all because of Make in India. So a great vision to put this theme. My personal congratulations to Satyaji for making this great event. So what makes India as a global destination for cancer care is the theme on which I'm going to talk today. You see, medical tourism is an industry, it's a sunrise industry, which is growing at the rate of 30% as on now. And the main reasons, you all know, low cost. We treat patients at one-third or one-fourth the cost than what treatment costs in outside Western world. There is a very high specialized team of doctors in our country. We have the latest technology available. Outside world, the waiting time for especially super specialty care is very, very high. So one of the main benchmarking for us, especially when we treat high-end bone marrow transplants or patient for complicated high-end surgeries, is the less waiting time which we offer. And of course, the integration with Ayurveda and alternative medicine, especially when I am treating the palliative cancer patient where cure is not always possible, but yes, the relievation of sufferings very much with the integration of Ayurveda. Now, special relevance to the accreditation system in our hospital, which has done a great work in benchmarking the healthcare delivery. The structure, process, and outcomes which are put by the hospital accreditation, especially NABH, has put India on the globe of medical tourism because the service standards, the quality standards which we follow, there are nearly 70 indicators which we follow into day-to-day practice for a hospital running, and these are benchmarked internationally. So what is the patient waiting time in emergency? How much time it takes for doctor to do the initial assessment when the patient comes in the ward or in the emergency? What is the turnaround time for various investigations? Like this, there is an entire plethora of more than 70 indicators which we monitor. So the treatment-wise, the quality care is as good as what you get outside. Even better, I would say, in certain areas. So these are the reasons why medical tourism is a big, big industry for us. And especially when it comes to cancer care, Dharamshila is known for providing highest quality care at a very cost-effective and ethical business model where cross-subsidy is practiced in day-to-day functioning. Friends, you all know cross-subsidy is something where rich pay for poor. We treat patients who are from the less privileged to very high-class patients like medical tourism, what I've mentioned, because rich pay for the poor. And this is internationally, having worked for Wockhardt for 3 years, this is internationally how HMI operates and how Harvard Medical International describes healthcare to be practiced, where the cross-subsidy model makes the business viable. Because ultimately, if the business is not viable, we will not be able to run it effectively and give the benefit to the payholders. Now, comparison, we say India is emerging out to be a very big player in cancer care. And specifically, I would say nearly 11 to 15% of patients coming to India are through medical tourism are coming for cancer care. And medical tourism market is estimated to be $4 billion and is expected to cross $6 billion by 2016. Yoga and Ayurveda is something which gives us a cutting edge, I would say, because compared to Southeast Asia, Singapore, Thailand, the yoga and the Ayurveda system which we have doesn't exist there. So it gives us a upper hand. And of course, technology they also have, we also have. But the integration, the great primitive thought process with what our elders taught us, what our rich cultural heritage has given us, the system of Ayurveda and yoga, that definitely gives India a cutting edge, especially I'm talking when it comes to cancer care. Maharashtra, Tamil Nadu, and Delhi are states where more cancer patients are enrolled. And as I told you, 30% growth year on year this industry is giving. Now coming to certain key aspects and potential markets, Africa, Middle East, Southeast Asia, these are the high markets which patients are coming. And of course, why they come to India, first reason is the medical technology, the latest technology which we provide. Out in our hospital, Dharamshila Hospital, we provide the latest cutting edge technology. PET scan is something through which you are able to diagnose cancer when it has not become cancer. It is in the molecular stage. So if you are able to detect cancer in early stage through PET scan, you are able to cure the cancer. Otherwise, detection at later stage, just you are left with a palliation offer. So Dharamshila brought the first PET CT to this part of our country, especially North India, and that is one of the key strengths of the hospital. The latest technology, whether it is histokine, tissue embedder, you find the latest technology, we are always there first to acquire it and bring it to day-to-day practice. These are all the photographs. I thought I'll keep the presentation more pictorial, that technology is what our top of mind always is. And getting the latest, whatever is the best we bring it. And the latest addition is this Dharamshila Bone Marrow Transplant Center, which we have started in our hospital. This is one of the best bone marrow transplant facility in the country because of certain reasons which I'm going to highlight. The infrastructure, ambience is simply world class. Dr. Maman Chandi had come from Vellore to inaugurate this center, and after seeing it, he was so full of praises and rated it as one of the best centers in the country. The reason is because for the bone marrow transplant patient, these are the patients who are of leukemia, lymphoma, multiple myeloma, aplastic anemia, even when bacteria can kill the patient. So a very high level of infection control is required. To achieve this, we have put special AHUs for each of the beds, and we are providing class 1000 clean room facilities in the hospital for such patients. So bacteria cannot get in, and the chances of infection are very less. We have spent 6 crores on creating this world-class infrastructure through which automatic selective controls, anti-rooms. This is a small room between corridor and BMT for maintaining positive pressure so that the air cannot come from outside inside. So this pressure difference creates all the difference, so that the chances of outside air is not able to come inside, and the inside air goes out, and that is maintained at a very high differential to prevent the chances of infection. So as I mentioned to you, this is one of the world-class facility which we have started about 1 year back, and I'm very happy to tell you, in 1 year we have done 16 bone marrow transplants, out of which 12 are successful. And special in this is the haploidentical transplant. You see, haploidentical transplant is a transplant where you don't actually need a fully matched donor. And that is why people used to go outside to get haploidentical transplant. Now we have brought in this same facility in our country in Dharamshila Hospital, and the haploidentical transplant, which is done with half-matched donor, means mother can donate and rest everything taken care by us, even if the matching is there or not. So even without 100% matching, we are doing successful transplants and saving the life. One of the core area of bone marrow transplant is very, very high potential, because in this area, we are actually able to give the cure to the patients. Cancer care, as you know, is one area where many times when you diagnose a case, it is in late stages, or stage 3, stage 4, then you are not able to cure the disease. Even if you are able to give the best possible treatment, you can increase the lifespan. But friends, to cure the cancer is something which you are able to achieve only if you are able to diagnose it early on. And there the role of technology is of paramount, as I told you about PET CT, and doing a selective screening, self-examination in breast. But especially in bone marrow transplant patients, even if you diagnose it later on, the cure rates are very, very high. And that is why this is the area where we get a lot of satisfaction in treating patients. Each of our room is fully bone marrow transplant room is having dedicated X-ray machines, dialysis machines, ventilators, you know, name it, everything, just like a full-fledged ICU bed. And to support bone marrow transplant facility,